Name is Michael Blazing. I am a cardiologist in the Department of Medicine. So the area of focus in cardiology I have is in prevention and in heart failure. I have a bit of a schizophrenic clinic in that I do prevention, which means I get healthy people who want to feel better. I get people who are sick but want good prevention but can't take it because they're intolerant to certain drugs, especially cholesterol-lowering type drugs. And that's my real area of expertise from a research standpoint. And then I see a lot of very sick people with very sick hearts, either because they have bad fuel supply or they have bad pump function. And what I do for them is put them in charge of their disease, teach them how to manage it. I guide, they manage, they do better. Probably one of the early patients that I took care of who had an impact in my career is a woman who had absolutely horrible coronary disease. Not amenable to being fixed by any technologies we had. When you looked at her angiogram, it looked like a moth-eaten spider web, to be honest. She lived under my care for 4 years, lived a very good life for 4 years. And that's where she taught me as much as anybody else how to get people to manage their disease and do very well when they're not supposed to. And it's a mixture of my guidance, a lot of fortitude on the patient's part, very much so, and not listening to what the pundits say. The favorite part of my job is watching patients get their aha moment, understanding when all of a sudden they now are in charge of the disease rather than the disease being in charge of them and their understanding of the disease. So I often will come upon patients when they've been spoken to in medicalese and haven't understand things, and they'll nod but don't know. And I pride myself in making sure that I communicate with people so that when they nod, they know. I make them tell it back to me so that I understand what they understand. They get a little tired of me because I make them repeat it 2 or 3 times, but we get along at the end of the day. And that satisfaction that comes from allowing people to actually then get their life back, that's the biggest part of my satisfaction for my job.